Good afternoon, everyone, and thanks for tuning in for our COVID-19 question and answer session series that we've been running. And today, we're going to talk about masks. And I have been wearing my mask, but I will take it off today, and so will our panelists, so that you can hear us clearly. There's been a lot of talk about reopening the economy, reopening hospitals, and I know everybody's anxious about that. But one of the key things for us to get things open and going again, we need to come up with ways to protect one another and the vulnerable populations, and masks will be key to that as we look at reopening the economy in the next few weeks. We're fortunate today to have some guests with us, and I want to honor social distancing, so I'm going to step off camera and we'll pan into our guests today, and I'll introduce those guests at this time. So we're very fortunate to have with us today Dr. Ronald Hopkins. He's the Chief Medical Officer here at the hospital, and Dr. Hopkins has been with us for 39 years.
Correct.
Good to have you today. And then also we have with us Tessa Torres. Tessa's been with us for 10 years. She's a physician assistant here at the hospital at the Levington Medical Clinic. So Tessa, thank you for joining us today.
Thank you.
So we're going to go ahead and jump right in and start talking about masks. And my first question that I have for you is there's a lot of questions and concerns in the community regarding face masks. Do they really make a difference? And if anyone doesn't have access to an N95, what's the point in wearing anything at all?
Thank you, David. Hello, everyone. Masks do make a difference, and we will discuss cloth mask and how you make one with a filter between the cloth layers. First, I would like to give some definitions for the general public. First is respiratory droplet. Now, these are large, slow-moving particles that fall out quickly. They typically are 5 microns in size and usually produced by coughing, sneezing, laughing from the nose, mouth, and lungs. Next is aerosols. These are small, fast-moving particles. They range in size from 0.02 to 100 microns. Now, these little fellas can travel up to 6 feet. Some things that we do in the hospital and at home that can make aerosols worse is nebulizer treatments and people wearing O2 masks and nasal cannulas. And that's why our healthcare workers, when they're in those situations, are using full protective equipment. Now, the N95 respirators, what we would call a mask, filters 95% of the particles from 0.3 microns to greater than 100 microns. Now, the National Institute of Occupational Safety and Health, NIOSH for short, certifies these masks prior to the shipment. Now, all hospital employees in most hospitals are fit tested with these masks to make sure that they're performing properly. Now, surgical masks, they have no woven material. They're produced by a melting, blowing technique. There's not many studies looking at their filtration efficiency. There have been a few independent studies that show that they filter particles from 65 to 80%. There has been at least one business journalist who knew the size of the COVID-19 virus was 0.13 microns, and therefore the N95 mask would be ineffective. But that's not true. Even though the virus is very small, or average as far as viruses go, due to the construction of the mask, you have fibers that are sticking out like this. Imagine this is the mask and the end of my fingers are the fibers. So if you have a respiratory droplet coming in and it's slow moving and it's a big blob, it'll stick on one fiber. If you have an aerosol, small but fast moving, it may bounce off one fiber and hook onto another one. And then you have the electrostatic layer of the mask. The virus will have a negative charge, the fiber will have a positive charge.
So we know that the N95 masks are our best option. However, if you don't have access to that, there are other masks that we can wear. This is an example of the N95 mask. It's rather thick and feels like a soft cottony type of material. This is the surgical mask. This is a cloth mask that has a HEPA filter inside of it. The HEPA filter can be washed and reused. This is another cloth mask, but it has a surgical drape inside of it rather than a HEPA filter. It can also be taken out, washed, and reused. This is a simple cloth mask, and it's just made of 2 layers. It does not have an insert. Certainly if we have inserts, that's going to keep us a little bit safer, but at the very least, a simple cloth mask will do. At the end of the video, we will have some links to make masks. Whether you know how to sew or not, we'll have some links available for you guys.
That's great information. Thanks for that. Quick follow-up question. Dr. Hopkins, you were describing how things are getting stuck in the mask. I would assume that it's probably important that if you're going to be wearing a cloth mask, that you wash that frequently after
Yes.
using it. Okay.
Absolutely. After every outing, we recommend washing that.
Great, great. So another question for you. When and where should a person wear a mask?
Practically everywhere you go. Grocery stores, hardware stores, restaurants, gas stations, convenience stores, post office, any face-to-face meeting you're going to have with someone, certainly a visit to your clinic, hospital, emergency department, lab or x-ray. And also, I would also wear gloves if you have them.
In fact, our latest case actually came from coworkers riding in a company vehicle together, so we also recommend wearing masks anytime you're in enclosed spaces, whether they're company vehicles or offices.
That's great advice. And from what I understand, Tessa, there are some people that can be asymptomatic and we don't know that they have it.
That's absolutely right. So there are asymptomatic carriers, and so when you wear a mask, that is protecting others around you if you don't know you have the virus. And if you're wearing a mask, then obviously you're also getting protection from others that may not know they are sick as well.
Okay, great, great. So my next question, what other precautions should we take to avoid catching the COVID-19 virus?
And these are the things that we've heard of over and over. So social distancing, that's 6 feet apart, so we can try to avoid those respiratory droplets and aerosols. Washing your hands thoroughly, so for at least 20 seconds, which is about the length of a happy birthday song. We also recommend sneezing or coughing into your elbow, even if you do have a mask on. These are just good practices to get into.
The HEPA filters that are available in homes, the freestanding ones do not appear to offer any further protection. However, if your HEPA filter is installed by the manufacturer on your heating and cooling unit at home, those work well. They're vented to the outside, and the HEPA filter can filter down to 0.3 microns.
Great. And by the way, on behalf of the viewing public, Dr. Hopkins, we appreciate you not singing the happy birthday song to us.
You're welcome.
So my next question, guys, is if anyone at home wants to comply to the face mask guidelines but simply can't get their hands on one, well, what can they do?
So again, there's all of these different options for making masks. We're going to link videos and tutorials on how to make sewing masks and non-sewed masks. Definitely putting in that layer of either surgical drape, HEPA filter, interface that you can find from a local fabric store or even online is going to give you the best protection.
Great.
Thanks, Tessa. The cloth that seems to work the best for cloth mask is denim and canvas. The worst is scarves. Some people were putting coffee filters in between the cloth layers, but the coffee filters actually filter a little too good, and you weren't able to move air in and out very well with them. So we don't recommend coffee filters at this time.
Okay, thank you. That's great advice. So my final question for the two of you is, why is it important to take all these precautions?
That is the most important question, David, is why. and everyone needs to understand what kind of situation we have with the COVID-19. First of all, COVID-19 testing is in short supply. There is no FDA-approved medication to treat COVID-19. There are medications being utilized, but those are simply from lessons we have learned throughout the world with physicians, nurses, respiratory therapists, and public health officials developing COVID-19 treatment protocols. And these protocols change rapidly. There's no one particular treatment that works better than the other. We have some clinical trials underway utilizing Remdesivir, an antiviral agent similar to Tamiflu, but drug trials take time. They require animal studies, human studies, and this can take several months. We do not have any medication to prevent us from getting COVID-19. We do not have a vaccine. This can take 12 to 24 months, and then an uncertain time to manufacture and distribute 7.8 million inhabitants of planet Earth a vaccine. Therefore, all we have is prevention. Adhering to social distancing, wearing masks, wearing gloves, all seem to be minor inconveniences compared to the possibility of saving a precious human life. This invisible enemy has brought into focus how fragile life can be and how connected all humanity is on this rock we call planet Earth. So we should endure this small inconvenience for humanity's sake because it's the right thing to do.
All right, guys, so it looks like we have a question that was asked of us by the viewing audience. Does homemade hand sanitizer work?
So to the best of my knowledge, there has to be the right ratio of the aloe vera and the isopropyl alcohol. Right now, the recommended alcohol content is the 95% isopropyl alcohol. Even with homemade hand sanitizer, we're still recommending hand washing as often as you're able to, again, for the full 20 seconds.
Yeah, so we can't wash our hands enough.
Right.
Exactly.
Yeah. Great. Looks like we have one more question. Can you sanitize an N95 mask, and how long does the virus live on an N95 mask?
We don't know exactly how long it lives on an N95 mask. The virus seems to populate and survive less well on cloth than it does on hard surfaces. As far as cleaning or sterilizing an N95 mask, Stanford did a study and compared using like a Clorox wipe or an alcohol wipe on the mask, and that damaged the fibers, and so they did not recommend utilizing that method. The best and easiest way to sterilize and reuse the mask is an autoclave with hydrogen peroxide, and we have those in the hospital. The poor man's method would be to get you a pot about this big with handles on the side, about this big around with handles, and then stretch the N95 mask across there and then steam it for about 10 minutes.
Okay, great. Thank you. We did have an additional question, and I think this is our last question, and I thought this was a great question because I've often asked this question myself. Early on, when this pandemic began, they initially were not recommending face masks.
Correct.
And I think, I don't want to answer the question, Dr. Hopkins, I'm going to direct it to you, but I think that had a lot to do with, one, the shortages of masks, and two, we didn't know as much about the virus as we do now. But do you want to take a stab at that? Why has the CDC changed their guidelines over the last couple of months?
Because, our federal government, state government, local government, our government institutions like the CDC, the National Institute of Health, they're all learning on the job. you know, they're making recommendations with the knowledge that we have today. And as we all know, in a week, it's going to be different. So initially, the push was to make sure that our healthcare workers had enough PPE, and we were, you know, saving it for that. Our ICU personnel, the doctors, emergency departments, COVID units, we were making sure we had enough PPE for the people that were taking care of those patients. And that's why there was a shortage initially.
Great. Thanks, Dr. Hopkins. And thanks, Tessa, guys, for joining us today. And guys, thanks for tuning in. I know one of the questions that you might have is, where can I get a mask, or how can I make a mask? And I know we addressed that a little bit today, but I want to encourage you to go to this Facebook post in the future, because we will post different links on how to make a mask sewing, or how to make a mask without sewing, because we want to present you with those two opportunities. You'll notice I have something in my hand. This is surgical drape, and the hospital district has an abundance of surgical drape because we're not doing surgery right now. And we're going to make this available to anyone in Lee County that would like to use this as a filter on your mask. So you can make a cloth mask, and we have a design that shows you how to make one without sewing. You can insert this in your cloth mask, and it'll give you an added layer of protection. So look for more information on our website as well at norlea.org. And again, thanks for tuning in today. This is important information. Wearing a mask is going to be really important as we move forward and try to reopen the economy and get our county up and going again. So thanks again for tuning in.